And we are live. You can go ahead and get started whenever you want.
Hi, everybody. My name is Louise Adler. I'm Chair of Canyon Dems. Welcome to our meeting. We're going to do a little bit of business, and then we'll have a presentation by Dr. Honigman, and then we'll have our regular committee reports. So the first thing that we do is we have a Pledge of Allegiance. So please join me. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, obviously a lot's been going on in the news. And so we were asked by the Central Committee to make a statement about Black Lives Matter. We had already put up the first part of this statement, the quote from Equality California, on our website and in our newsletter. But I'd like to read you the additional statement directly from our club. Canyon Democrats affirms that Black Lives Matter. Far too many Black lives have been damaged or lost by racial injustice in our country. We Democrats must each take action, because if we are neutral in situations of injustice, you have chosen the side of the oppressor. We must root out racism in our nation, our government, our communities, our homes, and in our hearts. We stand in solidarity with the protesters who have flooded the streets in our communities and across the country. They inspire us to take up the work that must be done to heal our nation. We commit to doing everything in our power to support candidates who stand for implementing social justice. Thus, we commit to working tirelessly to remove Trump from the presidency. And our club.
We can see it now.
Great. Okay. Oh, the Supreme Court obviously gave us something to be very happy about this month with the decision granting rights for employment for LGBT and trans people. Okay, and now it is not letting me move it.
You can always try hitting escape.
No, it's fine. Okay. I just wanted to remind us that we're still in the pandemic, which you all know, and that there are 221 people who died in Orange County, and there are over 8,573 cases now. So we still have a long way to go to get out of this. We're using the Zoom
slide.
Right, and that's where I was talking about the number of COVID deaths and cases here in Orange County. And we're using Zoom format, so if you don't want your picture shown, you can mute your video. And we will be using the chat function, which is right there, to take questions during the presentation. This is our agenda, and I'm going to try and rush along and make up some time here. One of the things we're going to be taking up tonight on our consent calendar is consumer choice energy, which we talked about before. And we now have a resolution that we would like you to pass as a part of the consent calendar, which will go to the Lake Forest City Council. And I believe that is also going to be, reworded slightly and sent to the Mission Viejo City Council as well. So this is the resolution. It has been reviewed and approved by the board. So I'm not going to read it all tonight. But if you have questions or you object to us passing this, you can pull it from the consent calendar. Okay, so here's the consent calendar step. And so we'll adopt the agenda. We'll adopt the minutes of the meeting, which were sent out. We will adopt the resolution, and we will adopt a motion to adjourn at the end of the meeting. So we get it all out of the way with one vote. So Canyon Democrats, would you please vote yes or no on the consent calendar? Start voting, folks. Okay, I think we have 100% for the consent calendar, which is a really good thing. Thank you very much. And we will move on. Which is not letting me do. It's frozen again. Ah, thank you. Okay, I just want to give a quick reminder of the critical dates here. Remember, October 5th is when ballots start arriving at home. So we've got a lot of work to do before then. And we have 2 more Zoom meetings now through the end of June, the social meetings. If you're interested in those, they're on our website. And finally, poor Dr. Bill, who's been waiting for me to fumble around here, is going to make a presentation. And Annie, are you going to introduce him?
Yes, I am.
Thank you, Annie.
Okay.
I can breathe.
Okay, do you need to go off share screen or can you?
Yeah, I do. Go
Okay.
ahead, Annie.
Okay. Well, before we get to tonight's program, I just want to tell you about 2 excellent presentations we have coming up in July. On July 9th, on Thursday, we're going to have a special webinar, and our presenter is Dana Rose Garfin. She's a UCI assistant professor in the School of Nursing, and she's going to discuss her research on the pandemic's effects on the individual's physical and mental health. And she's also going to provide some strategies for alleviating some of that stress. And then 4 weeks from tonight, the program for our general meeting will be Graham Boucher. He's a UCI Associate Professor of Political Science. He's going to speak about the effect of the pandemic on our political system. He's going to talk about how it might affect the election in November, how this current administration's handling of the pandemic might affect voting. So that also will be an excellent program. But tonight, I'm really happy to say we have Dr. Bill Honigman with us. He goes by Dr. Bill, and he's going to discuss where we are in achieving universal health care, and he's going to talk about COVID-19 policy and politics. To give you a little bit of background about Dr. Bill, he was an emergency room physician. He retired. He was in service for 35 years, and then he retired. He's been a political activist almost all his life. He's an organizer for the Progressive Democrats of America, and he holds several leadership positions with them. He is a fierce champion for health care for all, and he's also a climate change activist. And then just one little aside, he also has a personal connection with the Canyon Democrats because 26 years ago, he was the president of the Saddleback Valley Democratic Club, and that was just before it split into the Canyon Democrats. So he goes way back with us. But anyway, Dr. Bill, thank you so much for being here with us, and we're certainly looking forward to hearing you talk. Thank you.
Thank you, Annie. Thank you, Louise. Thanks, board, and everybody for attending. Yeah, I love Democratic clubs. I love sitting in. I love to hear what business you guys are talking about and attending to. And you know that to me, that's what it's all about. This is where the Democratic Party, you know, where the rubber meets the road, is right here in the Democratic clubs. And then, of course, we bring our message, our voices, you know, kind of up the food chain at that point to the county committees, the state committees, and of course the national conventions. We're coming up on those pretty soon too. So, but thanks for inviting me. Yeah, healthcare really has kind of become my destiny at this point, I think, because of my background in it. I worked in emergency for a very long time. I was a physician at Kaiser here in Orange County in the emergency rooms, both in Anaheim and in Irvine. Actually, Anaheim before they even built the Kaiser Hospital in Irvine. So I do go back that far in terms of my experience with healthcare. And you know, looking around the room, a lot of us do. A lot of us have that kind of knowledge and experience and background to know, you know, just how much reform we need in healthcare in this country. And it just couldn't be truer. It couldn't be more obvious than being in the middle of a global healthcare emergency at this point. I mean, you know, not even a national healthcare emergency. So I think that that COVID-19 is, you know, causing a tremendous amount of stress, anxiety. I think you're seeing that erupt in the streets because of the social and economic injustice in particular. And I think that it's actually worthwhile to kind of pare it down to some basics in terms of, you know, because we all hear about testing and masks and, you know, treatment, when's the vaccine going to be available, all that kind of stuff. And it tends to cloud the picture in terms of, you know, what can we actually do to make things better? So I did prepare a little PowerPoint on this. I'm going to share with you all at this point. Hopefully mine works. Sorry, Louise, about all the trouble you had. Let's see if this works for you. Okay, are you seeing my PowerPoint?
We are seeing it.
Okay, let's see if we can, I'm going to do it this way just to keep it simple. Okay, so yeah, I call this COVID-19 policy and politics, and I think you're gonna, you know, we hear a lot about the kind of the epidemiology, you know, the what the healthcare experts are advising us, but you don't hear quite as explicitly what policy, healthcare policy ought to be to kind of rise to the occasion. And also the political ramifications either way. And we all know at this point that our federal government has failed us miserably, that our state government is doing a decent job, but I think it could be doing a whole lot better. You know, here in Orange County, the incidence of new cases of COVID-19 and the hospitalization. I think that's a very important number to track because once you enter the hospital, you're definitely tested at that point, and it's a measure of severity of how bad a case you have. So if those cases are on the rise, that means we have not reached the peak yet. In fact, we have not even reached a plateau yet. So you can go to the Orange County Department of Health, and they do publish that data on a daily basis, and you can see very specifically that that we're nowhere near at the point, I think, where we should be backing off on these public health measures, and that absolutely includes social distancing and the wearing of masks. I always tell people the best way to stay healthy is to stay home. So, you know, so that means if you're going to protest, do it from home. If you can, especially if you need to, if you're older or you have other healthcare issues that put you at risk, then you need to stay home. But there's so much we can do from home nowadays, obviously, as well. So let me just point out that that Dr. King, of course, famously said, injustice anywhere is a threat to justice everywhere. And now we can say that's absolutely true in the setting of a pandemic because the virus doesn't know from anywhere, right? So the virus is threatening us all over the globe, doesn't know from borders, doesn't know from class distinction. All it knows is, aha, there's a human I'm gonna attack. So that means we all are at risk here. And, you know, it's absolutely absurd when I hear people say, oh, I'm healthy, I don't need to wear a mask. Well, yes, you do, because it's impacting everybody else if you don't. So, so I think this is, you know, kind of like an equal opportunity employer. The virus is an equal opportunist in terms of it being a parasite. So let's look at a few things involved now that, you know, I think it's especially clear to us now that we've been living, what's it, like 100 days now in quarantine, close to, you know, 3 months, 100 days. And that's, you know, basically what we want out of a healthcare system that would actually be able to handle this and do a decent job. And we'll go over examples of that. Obviously, I have a bias, and everybody here, I would imagine, knows that I'm a big fan of the idea of Medicare for all. So what does that mean? To me, it means what could otherwise be called universal health care, which means all the people get all the care. So there's really, you have to have two alls in there. Couldn't be truer than in the case of COVID-19, right? Because if we're not all tested, or at least a sample size that's representative of the entire population, okay? So remember statistics class, oh boy. But anyhow, it has to represent everyone, not just the people with symptoms, certainly not the people with the money who could pay for it, or who have access some other way to get tested. It needs to be all of us. So to me, that means the only decent way we can respond to this pandemic is universal. All the people have to get all the care. So what does that require? That requires resources. How are we going to, come up with the materials that we need? Financing. Who's going to pay for it? Always everybody's big question: who's going to pay for it? Although we don't seem to ask that about the military very often, do we? So when it's an existential threat, when we're being threatened off our shores, the climate, for example, is an existential threat. This is clearly an existential threat. The financing becomes less of an issue for the federal government, which can print its own money. So, so we ought to be looking at universal health care independent of, who it's going to cost, draconian budget cutbacks. We'll get into that in a little bit. And then prioritization. Who actually makes the decision? How do we prioritize where those resources are sent and how they're financed? Who makes those decisions? So we'll get into that too. This will actually go quicker than it sounds, because it obviously sounds very complicated, and it is. But that's the idea, is try and pare it down. So in terms of recesses, you have personnel, facilities, drugs, and supplies. So I'm a medical professional. I put personnel at the top. We need enough doctors, nurses, technicians, medics, clerks, etc. Right? Everyone agree? Facilities. We have to have enough hospitals, emergency rooms, intensive care, clinics. All of that has to be there for us. And then drugs and supplies, testing kits. Are those being withheld for somebody's personal gain, for example? I mean, that's what a lot of us have figured. Why hasn't there been more widespread testing in this country compared to other countries? And I'll show you some examples here coming up. So testing, tracking, vaccines, and other kinds of treatment and preventive measures. What has to be done to prevent, like with PPE, personal protective equipment, especially for frontline and essential workers who need them too. And when you don't have those things, when you don't have the resources, you end up with particularly bad outcomes in certain places. So we'll talk about that too. But in terms of the financing, where's the money come from? Public versus private. Public, you have public agencies and budgets, of course, and who drives that public public financing? It's generally politicians, of course, but also academics and other experts and advocates on the public side. On the private side, then we're beholden to private interests, like corporate driven ideas, like the market share involved, or other what they call shareholders. Who's actually paying the price of this thing? CEOs, are they chipping in, like they should in this situation? I have my opinions on that. And then, so you've got resources, funding, and prioritization. Okay, so how do we prioritize? Where do we allocate these resources? Everyone knows in healthcare in this country, we have traditionally underserved populations, right? What they call healthcare deserts in both our inner cities and in our rural areas of the country. And why are they underserved? Well, it's pretty clear there's no market for healthcare in those areas. So they're looking to suburban areas, perhaps like most of Orange County, and but not in rural areas. We were seeing hospitals close before the pandemic. Even more hospitals are closing now in those traditionally underserved areas, and especially communities of color, where they don't have the market base for building new facilities and having more staff and personnel, and putting more resources into those lower economic areas. So it's that this has been a challenge in healthcare in this country before the pandemic. Now it's of course even worse. And mobilization. How do we get those resources and funding to these areas that are needed? How do we triage and take care of those situations that are worse? And who's making those decisions, public or private? So this is kind of an interesting map that shows the at-risk population by state, and you can see, for example, that that some of the higher risk areas are actually relatively remote. So you have areas like I don't know, like I'm going to pick on Arkansas, for example, which has a whole lot of rural part to it. On the other hand, Utah is a very rural state. So why are these blue areas more at risk than, say, the pink areas like our state and other areas here? That it's largely because they haven't set up the healthcare systems that are needed to be able to respond to the crisis. So these are those areas, a whole lot of them, of healthcare deserts. Now, when you look at it by state, it's not as obvious that, say, within New York, for example, New York City, you have those underserved populations in a very population dense area, and here in California as well. But we took the initiative to go, much earlier and further steps in our public health measures, which was a good thing. This kind of introduces the politics, because you saw those underserved areas. A lot of it is the red states in America, and so of course we're areas where they have not expanded Medicaid, which of course the Affordable Care Act allowed states to do that, and red states opted not to because they believed it was going to make their situation worse, because they tend to listen to Fox News and the Fox News echo chamber. And so what happened there? So now especially, I think you're seeing the red states get particularly hit hard by the pandemic. So that is coming true. But you also had this, public versus private kind of dichotomy in the decision making. Public, as we said, tends to be experts and academics. Private tends to be corporate and market-based decision making. And you have an interesting merger of that in what's called a public-private partnership, which kind of makes me want to gag on, whenever I hear Mike Pence use that phrase. I always think when someone says, privatization, think profitation. And so who's making money off of that partnership, especially at a time of severe public need the way we have it now. So here's a good slide, I think, that illustrates the countries who were especially on top of this early and did a tremendous job. And you can see one of the leaders of the world was South Korea. And why is that? Because of testing. So they tested early and often, right? It's like they say about voting, vote early and often. No, I'm just kidding there. But testing should have been done early and often. And you can see that, South Korea in particular tested so many people, they actually lowered their response per capita, as a result. And in this slide, it's even more apparent. You can see, direct head-to-head comparison of the United States versus South Korea. Early on, at least, they were doing more testing in one day, twice as much testing in one day as we were doing in 2 months. in the country of South Korea. And why is that? Well, they have a single payer Medicare for all system in South Korea, in Taiwan, in Canada, of course, we know our neighbors to the north, where the public is involved in that decision making. And an even more graphic illustration is this. A very good friend of mine lives in Laguna Woods, made up this this chart, but it's actually it's done in immense detail. And he's a health systems analyst who's originally from Canada. It's a fine, wonderful person named Henry Brosguy. He loves to have people share materials he draws up. But being from Canada, he knows how the Canadian system works very well. He also has a PhD in health systems. But you know, you tell me which one is the Canadian system for paying bills and which one's the U.S. system for paying bills. Anybody? So it's pretty clear this is the U.S. This is how he says actually there's about 3 or 4 layers underneath this one layer. So he couldn't include all of the different, you know, agencies and private agencies, private insurance companies, you know, pharmacy benefit managers, all of these intermediaries, all of these third parties and these extra hoops that we have to jump through in this country make it incredibly difficult just to know what's going on. A lot of these are all private entities that don't share their information. They have proprietary rights over their information. So, you know, when you have a system like this, the government knows exactly where the needs are and where to allocate the resources. I challenge you to find that in the system that we have. I mean, I'd like to blame it all on Donald Trump, but you know, all this mess happened way before Donald Trump, right? It's like they say Donald Trump's a symptom, not the disease. So here's what I think we need to do politically, and then I'm actually done with the slides. We can take questions and comments. I think what you're seeing here is big insurance and big pharma have set the priorities and how we access healthcare. They've created these healthcare deserts, and that's made us horribly unable to respond to national public health emergency, a global public health, how to compete in a global public health emergency situation. We're in sad shape, folks. This public-private partnership, like I said, it's profitization for certain individuals. Every time Mike Pence says that, think who's making money off of that deal? Mike Pence, thank you very much. I'll vote for the Democrat. Here, prior policies of cutbacks to public health. Probably most of you have heard that the Trump administration has been dismantling our public health, you know, like it's done on the environment and lots of other, you know, public agencies that have done good. I think we successfully prevented the spread of Ebola to our shores, the SARS virus, the MERS virus, because we had better public agencies set up. We could do better yet with a single payer Medicare for all system. I'm quite sure of that. So, and that also creates this, which is wellness for the wealthy. I think Dr. King said that something like that too. Like we have socialism for the wealthy and rugged individualism for the poor. We have created wellness for the wealthy. Our vulnerable populations, which include our communities of color, absolutely are not getting the treatment that they need enough to lower their risks. We all know those are what are called social determinants of health, and you know, extremely inaccessible in those healthcare deserts, whether it's inner city or rural areas, have created this disparity that we're all seeing now, and it's spilling out on the street. And finally, the global warming situation, or you know, more accurately, it's rising global temperatures, right? So as the temperatures, global temperatures rise, we expect to see more of these novel viruses and bacteria, as well as other environmental toxic exposures. Once the tundra is no longer frozen, and these things are released into our atmosphere. So we better be ready, even if we can't have Medicare overnight. That could help us, Medicare for all overnight, that could help us deal with this COVID-19 catastrophe we're in the middle of. We need to be ready for the next pandemic to prevent more suffering and death. And I can't tell you how miserable I imagine it is. And maybe some of you have experienced this, where a loved one had to be admitted to the hospital for COVID-19 and you can't visit them. You can't be at their bedside. You can't really know what's going on with them without being there. And you know, why should we allow that to continue on to the next pandemic? And there will be more. So here's the to-do list. I think we should all call our members of Congress today and demand that they support Medicare for all. I think we still have 3 members of our 7-member delegation, all Democrats from Orange County, who have not signed on to the Medicare for All Act. And you know, we need to thank the ones who have, like Katie Porter and Mike Levin, and we need to spank the ones who haven't, like Carly Ruda and Gil Cisneros and my friend Lou Correa. We should all also ask them to sign on to HR 5010, which is the State-Based Universal Healthcare Act, because you can see now that Gavin Newsom, you know, is much more capable of dealing with this than whoever's in the White House, whoever's controlling the Department of Health and Human Services, or the CDC, for that matter. CDC used to be beyond reproach. Now we can't even trust who's the head of the Center for Disease Control. So, you know, headed up by, what's his name? Oh yeah, Ben Carson. Give me a break. And then, you know, there's another piece of legislation folks should look into. This is the Healthcare Emergency Guarantee Act. That we have 22 sponsors, not a single one from Orange County yet, unfortunately. And this one is an interesting bill. It actually provides Medicare to anyone who's currently not insured for the period of time of the COVID-19 pandemic. So it will cover all the uninsured, and it will pay the bills, the extra bills for the underinsured. So if you have a deductible, if you have a copay, this Medicare will pay for that. So it's kind of halfway, or actually a pretty good shove toward Medicare for all for the period of time in the pandemic. It not only is affordable, it will cost less, just like Medicare for all costs less. It will actually, fiscal studies have been done and show it will cost less than what we're currently paying for healthcare now. So this is a great step forward, and you know, as opposed to something like the public option, which I think is a step backward, but we could spend an hour talking about that too. And then finally, those of us who have any influence at all with our DNC members, the Democratic National Committee elected members, and anyone going to the convention, like myself, for example, I'm a delegate, oh boy, we should be pushing for Medicare for all to be in the 2020 Democratic platform. We got a designation of climate emergency in the Democratic platform in 2016. This year is the year to get Medicare for all on the Democratic Party platform, which will tell people that the Democratic Party stands for real universal health care, where all the people get all the care. The Republican Party certainly does not. The Democratic Party needs to stand up for what's right for healthcare justice for this country. So if Dr. King also said, of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. And I think he knew what he was talking about, which is the moral imperative here behind what we do about this pandemic and the pandemics to come. So thank you so much. And I'm happy to take questions or comments at this point. I don't know, we have more time. Oh, thank you.
We have a couple of questions from the chat. Judy Harrington wants to know what she should tell family members or friends that say cases are going up in Orange County only because testing is going up in Orange County.
Tell them they're right, but it's not only because testing is going up. So in areas where you don't test, you don't know what's going on. And we still don't have universal testing. So it is hard to interpret the data either way. With no testing, you just don't know. And when you don't know, you're, you know, you should be extremely cautious. At that point, extreme caution is necessary. So yeah, don't, you know, I wouldn't trust the data either at this point. I'm not going to trust that, you know, it's okay to go to the grocery store or to Starbucks again. You know, I miss my Starbucks habit, that's for sure. But I'm going to believe it when I see it, when I see those numbers consistently going down.
We have a couple of like very practical questions. One from Mark O'Connell, who wants to know if you know of any COVID blocking masks and where he can find them. And Aaron Schwartz, who wants to know if you know anything about rapid testing in Orange County.
Yeah, so I think it's hard to know. We kind of are in an information void, and we do depend on our public agencies to help us with those things. And sadly, you know, both at the federal level and here at the county, we, you know, most of you have heard that her name, Dr. Quick, I believe, who was basically forced to leave the county, you know, public health department. Horrible thing. She was actually presenting, you know, decent information to people, and she was forced, you know, because of the political environment on our board of supervisors to leave. So, so it is hard to know. I could just tell you from my background in healthcare just a little bit. I'm not an epidemiologist. I'm an emergency room doctor, but I can tell you, for example, when we had the Ebola scare, and we had to be prepared for that, you know, reaching our shores. We did use N95 masks. That was very well studied. There was good data to support using an N95 paper mask, okay? But a couple of things. You wore it with one patient encounter, then you threw it away. You didn't wear it the same one all day. You didn't put it hanging on, you know, in a paper bag on the wall and use the same one again the next day. You didn't try to clean it. You know, although I hear there's like hydrogen peroxide vapor or something that can clean. Anyhow, they also had to be fit. They had to be properly fit, and we tested everyone to make sure that they were properly fit. If not, you wore something called a PAPR, personal something. I forget what it stands for, but it looks like a space helmet, basically. And I can tell you, I don't think I have a weird shaped face, but I never properly fit an N95 and had to wear one of those PAPRs. You know, and you know, again, you took it off after every patient, and then it had to be cleaned, and you had to use a different one, you know, until that one was clean. So, so it can be very tough. I think there's decent information to say that out in public, if you're not a healthcare provider, we should all wear a cloth mask. You should not wear a mask that has some valve in it that where the exhaled air goes out, because you're no longer protecting the other person at that point. So you should, if you do have a mask with an exhalation valve like they sell at Home Depot or someplace, I don't like that store. Lowe's, okay, if you bought yours at Lowe's and it has a little valve, buy the paper filter to add a little more protection so you aren't exposing other people. And you should demand that of people that you have to interact with, like your dentist or someone. Make sure they're wearing a mask that doesn't have one of those little valves too. And then in terms of testing, there's basically two kinds of tests. There's the rapid test that is supposed to tell us if we've been exposed. And then there's the antibody, that's an antigen test, and the antibody test that tells us if your body has reacted to that antigen by forming antibodies. Guess what? This is a brand new virus. They don't understand how that works. I can tell you, like, for example, hepatitis B has been around a very long time, and we tested everybody using both. And, you know, I'm sure in places like Taiwan and South Korea, they are doing exactly that. They're using both tests so they get the most information possible and not relying on one test. There's a very high degree of false negative tests. I'm sure you've all heard that. A lot of people think that they're sick with COVID and they had a negative test, it does not mean you don't have COVID. So, so be very, very cautious about testing as well.
We have a couple questions about Medicare for all or universal health care. Just in terms of one very general question, how you would pay for it, which is a monster question. And then also, what does it mean for people who want to keep their private healthcare insurance, or what happens to Medicare under Medicare for all? Does the senior version of Medicare for all go away, or is it just like two different types?
It gets better. So let's start with that. It's expanded and improved Medicare for all. Okay, so if you have a supplemental now, and a lot of us are 65, I think, in this room or older, you had to get a supplemental. Usually it's called Medicare Advantage or Senior Advantage. That goes away. Co-pays, deductibles of any kind go away. You get more services. You get dental, you get vision, long-term care, hearing aid, and you get full mental health services, including alcohol and drug rehab. Nobody's Medicare is that good. I guarantee you, nobody's current Medicare is that good. Okay, and then let's see, and that's true of your private insurance. I don't care what policy you have. This one has more benefits at a lower cost. So what is that lower cost? Okay, this has been studied. Gosh, the first time I looked this up, I could find legislation here in California dating back to 1971, a bill for universal health care in California that was authored by Speaker Willie Brown and President Pro Tem of the Senate, John Burton, together. Okay, they pushed for a universal health care bill. I think it was still Ronald Reagan who was governor at the time. So of course it didn't happen, right? But it's been studied that far back or further back. You know, you can go all the way back to Teddy Roosevelt. And the last pandemic that we had was 1917, that we can save money, it will cost less. So whenever you hear how are we going to pay for it, you have to ask the question, how do we pay for it now? You know, how much of that really is chipped in by your employer as opposed to taking away from, you know, wage and salary increases that we would have if it wasn't for that employer-based health insurance. How much of it is, you know, coming out of our pocket in terms of out-of-pocket expenses, surprise billing, they actually call it balance billing. You know, when you see somebody out of network, oh yeah, by the way, networks, all gone. You can see any doctor, go to any hospital you want. That's part of the expanded and improved. And it's a huge economic boom. The economy is going to go up. That third of every healthcare dollar that we're wasting now gets invested into healthcare. Imagine that, actual care. We can build more hospitals and clinics, hire more nurses and doctors. That expands the economy. So that gives us a wider, broader tax base. So the money you will pay in taxes will be much, much less. I know, you know, I'm a Bernie Sanders fan. Bernie's best analogy was most people pay about 10,000, you know, on average 10, 12,000 a year. That number will go down to most people paying 2,000 a year. That's a fifth of what you pay, you know, under this proposed mechanism. So, so, you know, let's not just look at it as a tax increase. Let's talk about it as getting value for what you're paying for. Right now, we don't get what we pay for. With that, you get all those services at a fifth of the cost. I call that a sweet deal.
Annie Krinsky, somebody we all know, would like to know, would you have an option for people who are happy with their private healthcare if they want to keep it? So would there be any sort of room for a private insurance market?
Well, unfortunately, no, because private insurance is still skimming off the top. Now, you know, you could bring up, like, say, what they do in Switzerland, where they have left private insurance in place. They make about 2% over what it costs the government to run, you know, their public health plan. Okay, 2% profit margin. Guess how much our insurance companies pay? 10 times that, 20%. So all our private insurance companies, and you know, and I worked for a group that was also an insurance company. Even that one, I think, sucks. It's terrible. we are getting ripped off by private insurance. Now, if private insurance agreed to make 2% profit instead of 20% or 30% profit, then I might be on board too. But at this point, no one's talking about that. Yes, we'll take a pay cut down to 2% profit margin. They aren't talking about that. So no, sadly, I don't think there's room for private insurance, you know, if we also want to have all those benefits at that lower cost.
We have one more question, just about if you know of any other, from Julian Joshua wants to know if there are any attempts from doctors or healthcare professionals in Orange County to put pressure on the Board of Supervisors to reinstate the mask requirement in Orange County.
Excellent question. Thank you for that. You like teed one up for me. So besides Progressive Democrats America, I also organized for a group called Physicians for National Health Program, PNHP. Their PNHP.org is a wonderful resource if you go to their website. They're actually based at Harvard Medical School of Public Health. And so these are, you know, MD, PhDs. For those of us who believe in science, which is probably, let's see, raise your hand if you believe in science in this room. That's everybody. Science believers, not science deniers. Apparently all Republicans are science deniers. There are still a few science deniers in the Democratic Party as well. But these people are scientists. They publish data in reputable journals like the New England Journal of Medicine all the time. And they saw the writing on the wall 30 years ago. That's when PNHP formed. And they started out as just physicians, but it's grown. So now it includes nurses, other health professionals, and guess what? Other people who are not health professionals. So you can go to pnhp.org and check them out and maybe join. We're trying to get a chapter going here in Orange County. We've never had one. We have a wonderful fellow, some of you might know in San Juan Capistrano, by the name of Don McCann. Anyone know Don McCann? He's a beautiful family medicine, retired family medicine doctor. He's kind of stepped back from his activism somewhat like I might do when I get to be his age. But Don McCann was one of the founders of PNHP. So myself, my friend Henry Broska, Danette from Orange, she's a PNHP member. We're trying to get a PNHP chapter going right here in Orange County. You can message me anytime, Dr. Bill at pdamerica.org. That's a pretty simple email. I'm sure Louise and Annie can connect us. I can tell you more generally, doctors generally poll the same as the general public. So doctors are not a fan either way. Many doctors would like to have more time to spend with their patients and see a Medicare for All system as a way to do that. Right now, they're spending way too much time on the phone talking to insurance companies instead of, you know, directly to their patient. And that's why places like Japan and Canada, that's why they live longer than we do. So a lot of doctors get that. On the other hand, there's some entrepreneurial types in medicine that don't, and they want to exploit it, and they're seeing their, you know, their patients like a mill and just cranking out the cases. You know, that tends to be the surgical subspecialty, what I call procedurologists, you know, family doctors, pediatricians. We woefully underpay our pediatricians in this country. Just like we underpay our teachers, we also underpay our pediatricians in this country. Compared to Canada, they make much better money in Canada. So I don't want them to all leave and go to Canada. I want us to reform this system so that good family doctors, pediatricians, you know, basic OBGYN and mental health providers are all paid better. So we are working on that, and I invite you all to join us.
Thank you, Bill.
Okay, thank you so much.
All right.
Thank you very much for coming and sharing your time with us. We appreciate it a lot.
I love you guys. I appreciate coming anytime. I'm happy to come back. So
Thank you.
Okay, folks, so now we're going to have our field team. Faye, do you want to take it over?
Yeah, do you want to share your screen again? So they can,
Oh, yes, thank you, Faye.
I just don't want to have to hold them up because they're heavy.
Yeah, hold on. I gotta figure out how to get there. I have to open this and then share screen. Did it take the share screen, Rach, do you think?
Not yet.
Not yet. I've clicked it. There we go. Okay.
There you go.
All right. There we go. Okay.
Okay. There we go. We got it, Louise. That looks good. So we've been doing wellness calls. We're trying to stay active and stay engaged and still reach out to voters now, even though our actual face-to-face time is obviously restricted. So we've got a phone bank set up, and we've had probably 9 or 10 or 11 people off and on jumping on the phone bank and making wellness calls. These are Democrats that voted in the primary, so they're our people. And our goal here is just to find out how they're doing and introduce them to Kenyan Democrats, and try and find out if they've completed the census, and then also if they need any help registering to vote. So we've got kind of a 4-point goal that we've got here to try and talk with folks. And the calls have been going really, really well. Right now we are at 65% done with our list, and our list was to reach out to over 2,500 voters. So our callers have been really, really hitting it hard and having some really good conversations with folks. We've been able to help a couple of people that have had trouble with some of the government agencies. We've been able to turn them over to, like the Small Business Administration or Katie Porter's team. Response from the people has been really, really positive. If we manage to talk to someone in person, they usually thank us for calling. So it's being really well received out there by folks on the other end of the line. So Louise just put up the slide. The event is actually on our website. It will take you out to Mobilize to sign up. You just have to sign up for any day. Once you sign up, I'll send you the information, and then you can hop on and off the phone bank on your own schedule once you get signed up for it. So you don't have to sign up for every single day. Once you sign up and you have the link, you're good to go, as long as it's between 9 in the morning and 8 p.m. at night. You'll get a confirmation like the one on the right-hand side, and that's just advising you that I'll be personally sending you an email with the link to actually access the phone bank. So once you get on there, you just go at your own pace, and if we've got instructions for you, the script is right on the screen. You just go for it. And if you have any questions, we've got contact information there for both me and Louise, and we can usually get back to you pretty quickly if there's a question. So that's out there. Go to our website, sign up. So the other thing that we're kind of doing, we're kind of affectionately calling it Rock the Vote. A lot of us live in these areas that are a little bit restrictive. We can't get out, for one thing, and we can't put signs in our yards. So we're doing a little bit of garden art on rocks and putting them out in our yard along the sidewalk. I've got them leading up to my front door. Any kind of high traffic area that you might have like that, where people might be walking by. And we're just encouraging people to keep thinking about voting. So these are just rocks. Several of these are found rocks that, we just painted. It's a Sharpie. It's pretty easy to do, really. We just want the word vote out there. It's nonpartisan. We're not trying to sell anybody on a party or a candidate. But we've had some fun with it, just decorating the rocks and putting them out there in our yards and our garden. So just be mindful of where you put it. Don't put it in your neighbor's private property. They probably won't like it. And eventually, we're using Sharpies for the markers. They seem to be working the best. You can use found rocks. Some of the black ones that we used were from Michael's. They're just filler rocks for flower pots and things like that. But it was kind of fun to do, and we put them out there, and we're just kind of keeping our eyes peeled for other people in the neighborhood that might be picking up our little garden art rock event. So we're calling it Rock the Vote, and we're just trying to get them out there. So it's not something you even have to sign up for. Louise, you said you've got some out in your neighborhood?
Yeah, I did it today. I just
Just
picked up
today.
a rock from my yard and marked, please vote on it with a felt pen and put it out near where people can see it as they walk by.
Yeah, yeah. So that's how we're occupying ourselves now. It's fun, it's crafty. If you like doing postcards and playing with paint and markers, it might be for you. It's just, it's not even really something you need to sign up for. We're just kind of trying to keep ourselves busy and get the word out as best we can.
Yeah, and if we get enough of them out there, people start noticing it and talking about it.
Yeah, yeah. It's just,
Okay.
it was kind of fun to put it together. So
Yeah.
that's what we've got. We're still working. We're a little ways away from actual get out the vote activities, and we're hoping that the current situation with COVID-19 lets up a little bit so that we can get a little more face-to-face with people, but we're working on alternatives. So that's what we've been up to.
Thank you, Faye.
Thanks.
Okay, Anne, do you want to talk about community outreach? You're muted, Anne. We have to unmute you.
Okay. There's an important event coming up in Lake Forest. Lake Forest is one of two communities in all of South Orange County that is attempting to build an affordable housing unit, which is going to be across from the post office on Raymond Way. And on Thursday, June 25th, National Corps, which is a company that is building it, is going to be holding a meeting at the Lake Forest Civic Center, whereby people can come and express their pros or cons. I'm sure there's going to be a lot of cons, but as Brooke Weitzman told us in our, was during a meeting, but we did have a Zoom meeting with her about a week ago, that affordable supportive housing is the way to go to solve the homeless situation. So you may also send emails to the Lake Forest City Council members and community development people, but they have to be in by this Thursday, the 18th, which gives you 2 days to write a letter and say that you support affordable housing with support services in Lake Forest. And I would also add to that letter that it's the most economical way, as well as dignified, respectful way to solve the homeless issue. So you don't even have to be from Lake Forest. You could be from Mission Vale and Laguna Hills, because you're a surrounding community who probably will have some homeless people from your area that will be able to live in this particular place. So the meeting is at 6:30. You can go and you can sign up. They usually give you 2 to 3 minutes to talk. And so I encourage all of you to take part in that. And if you have any questions, you can just email me at owens@cox.net, and I'd be glad to answer any questions that you have. Okay, next slide. Okay, so remember when we used to do all those wonderful collections for working wardrobes, and unfortunately they had the awful fire this winter. Well, they are opening up, and they have a new center at 17392 Domler Street in Irvine. And they're open from 9 to 3, Tuesday through Saturday. They do want all clothing on hangers and clean. So you can go to workingwardrobes.org if you don't have a pencil to write all this down now. And but they're open for new donations. They're kind of starting from scratch. So since we don't have meetings to collect these items, it's going to be up to you. But it's not very far away. It's kind of on the south side of Irvine, so it's not really very far drive. So I'm sure they would love to have any other of your gently used clean clothes that would be donated for that. Okay. All righty. And are we on to the next one?
Yeah, the membership one.
Okay, so now I'm on to membership, and look at our numbers, guys. 365 we have 69 brand new members, and we are doing well. I've probably been calling a bunch of you this past couple of weeks. We're trying to collect everybody's, be sure we have your cell phone number. So if I have left a message at your house, some of you I have talked to in person, or you think we do not have your cell phone number, you can also contact me, membership, and share that with us, because we're trying to get into the 2020 world and do a little more texting versus emailing. And we are sure we have your cell phone number, then we can be sure you are in on our text. If you didn't get like the text for the meeting tonight, you are not on our text list. So that's just something else that we are trying to promote. Okay.
And the shop.
And now on to my third hat. I'm the merchant. So we have this wonderful shop that I'm finding a lot of people don't know about. So if you go to our website, canyondems.org, there is a shop on the little rotating screen that goes around. You can also go up in the top corner and click, and under membership it says shop, and there are wonderful things to buy. So we can't canvass, we can't do voter registration, but we can still advertise and do a fundraiser at the same time. So Jenny Golden has made us these adorable masks. Wait a minute, I'm gonna put mine on. Can you put me on there?
Well, I think people can see you, can't they?
Can they see me? I'm seeing you, so I don't know.
Oh, there you are. There you are.
So this is Donkey and Vote on this one. And let's go back to the slide, because that's better than I am.
Yeah, unfortunately, I noticed, Anne, that the slide we worked on didn't get in here. So
that's okay. We have two other brand new ones beside this. We have a one with American flags all over it, which is wonderful for 4th of July. And then we have one that's kind of the word Democrat, but it's in like this collage design. So I bought two for my friends, and one I gave for a birthday present to them. One I just gave as a I like you present, wear this. And so it's wonderful. You can wear it to the grocery store. And I know one of our members bought one, and she says she has people saying, oh, that's so cute. Where did you get that? So it's a wonderful way to spread our message by wearing this. And then we have water bottles also, t-shirts, and beautiful jewelry, a whole bunch of bracelets, earrings, necklaces. We have a whole variety of jewelry. So I know Louise did have a slide. I guess I didn't get up, but it shows basically that people who are wearing masks are Democrats, and people who are not wearing masks are that other party. So you don't want to be considered to be one of that other party. You want to be showing that you're a Democrat and you're proud to share that information with the world by buying a mask. So you can go on tonight and click and shop. Okay, so that is it.
Thank you, Anne. Okay, so we're going to hand off now to Janet. Janet, are you there? Janet Henry. You must be muted, honey.
I got her. There she is.
There we go.
Okay.
All's good?
Yeah, all's good.
Great. Welcome, everyone. Nice to see all of you here. Elections are getting closer and closer, very exciting. So you will see our 3 dedicated candidates so far. And for school board there on the left, we have Susie Schwartz, who is running in Saddleback in District 3. And then Ed Wong, who is also in Saddleback in District 2. And they are incumbents, so we'll be working closely with them. And then we are very excited to actually have a candidate for city council around here, and that is Pauline Hale. She will be running for Mission Viejo City Council, and I have lots more to tell you about Mission Viejo, just in case you didn't know. So there you see, local election transparency. So little did you know that we've got a couple of cities that are pretty transparent. And you can see there we got an A+ For Lake Forest and Laguna Hills, you go on their website. They list when they are going to have their elections. They list their filing period, and they have all kinds of information. They're very transparent. Rancho Santa Margarita, not doing very well. And when I contact them, dragging their feet. So I contacted them again yesterday. So I would like to ask all of you, and these addresses will stay up there, to ask the city clerk, who basically does all the does the work, but the city council needs to know what's going on, and ask the city to put the details on their website about their filing positions. When is it going to be open and when is it going to be closed? Now, as I said, Amy did write to me and tell me this. And she said, oh, that they'll get that up there on their website soon. So there's no reason for this. So ask them to put up the filing period and to make those documents available. So I should be able to go on there right now, download them, fill it out, and do all of that. Now, Mission Viejo, raise your hand if you live in Mission Viejo. You've got a lot of work to do. You have a city council that 3 years ago was sued for not having an equitable election. They lost the suit and they vowed to do a better job and to get it right. Well, here we are in June of 2020, and after months of me talking to their city clerk, now I'm on to their city attorney. Oh, they're gonna get it. Oh yeah, they're gonna get it. So enough is enough. So tomorrow, by the end of the day, if you will please contact all of these people. You see the city clerk, the mayor, each of the city council members, and you can send it as a group text, and I think you should, so everybody knows that everybody's being communicated with. And basically, we still don't know, how are the elections going to be run? Are they going to do cumulative voting, where if you live in Mission Viejo, you get 5 votes and you can do 2 for this candidate and 3 for that? Or you can do 5 for just 1? Or are they not doing that and they're going to do it by district? Is there a third method? What is the election looking like? If we have a candidate, how do you get your campaign going if you don't know what it is? So they need to know what is the election process, and they need to know when is the filing period, and we need to have the documents online. So please, let's hold our folks accountable and get that letter off. It doesn't need to be long, just bullet points, and let them know that I'm not the only one. Now, we do have Ada Briseño, who has one of her assistants who has also contacted the city attorneys. So we're beginning to put a little pressure on them, but still no action. So I think if you were to send a letter, I bet we would get some action by the end of the week.
And it's helpful, I think, in the case of Mission Viejo, that it is citizens who live in Mission Viejo.
Yes.
So if you think about it tomorrow and you weren't able to write all this down, just email me, chair@canyondems.org, and I will send this to you.
Yes. Yeah, and I think it also goes to show how these elections have been very closed for so long. Nobody has asked these questions. They just kind of, you know, the same people rotate in and out. And when their term's done, then they get a friend to hang on for a while, and they come rotate back in. It's a very small select group. Nobody knows what's going on. And we're there to make sure that the people in Mission Viejo know what's going on. So thank you for doing that, and I'll keep you posted.
And thank you, Janet, for tracking all that down for us.
Okay, thank you.
Yeah, that's what democracy looks like.
Right, go.
Yeah. Okay, and Kathy, are you there?
Yep, I'm here.
You want to say something about your efforts here?
Still haven't gotten any new people or any new companies to sign up. So I'm going to do a quick little primer in case there's new people on this week's or this month's call than there was back in May. Real quick, this is just for Canyon Democrats members who also are local own local businesses, whether it be a print shop, whether it be a donut shop, a coffee place, a little restaurant, real estate, whatever. If you're a small business owner in our area, South County OC, and are a member of Canyon Dems, you can email me at business@canyondems.org. And what we've done with a few people is, if you look at that URL, the canyondems.org/shop local, is we put up your logo, your contact information, email and phone number, and a little bit about your business. And at some point in time, when we all get together again and get to meet in a real setting, where we can actually talk to each other, we will also have opportunities where one of the small business owners might be able to say sponsor the little snack table. And for that, then they actually get up in front of everyone and say, hey, I'm me, and this is my business and what I do. Come see me. So
Okay,
it's just sort of like a little referral thing.
Super.
So there you go.
Thank you very much. Okay, Marty, fundraising. Most important thing, because we want to give money to these candidates so they can get elected.
Yes. Am I muted?
Nope.
Okay, good. So we have two programs going on right now because we are not able to do the things that we used to traditionally do. The first one is our Sustaining Donor Program, which was the brainchild of our own Walt Lawson, and it's been very successful. You can see that we've got, at the moment, 56 sustaining donors, and we've raised $5,988 by this program alone. And so it looks like we will hit the 12,000.
That's this year.
That's just this calendar year, 2020 only. So the Sustaining Donor Program has been wonderful. If you are in a position where you've got an extra $5 a month that you could add, excuse me, to an ActBlue account, that will be $60 for the year for us. And that makes a big difference in terms of our being able to support candidates. If you just want to write a check for $60 or go on ActBlue, $5 a month is the minimum we would expect. But if you're able to do a little bit more, we would love that. So
you just go to our website and
go to the website
donate
and it's
button.
Right. Excuse me. Then the second program that we're doing, and this was the brainchild of our own Melora Kleckner, and it's been very successful, and we've had so much fun. We're doing a car parade brigade, and for a donation of $50, we will come by your house, all jacked up in our patriotic stuff. 5 or 6 cars will come by and honk like to make your neighbors crazy. We've done birthdays. We've done just for no particular reason, kids going from one grade to the next. The first big one that we did was this past Sunday on Flag Day. The next one we expect to do will be on July 3rd. So if you are interested, we will have that up soon so that you can sign up for your $50 and have us come by on July 3rd and wake up your neighbors. If you'd like to be a part of the brigade and come with us, we have a great deal of fun driving all over our our area. There's a link on the volunteers section on the website, so you can sign up to volunteer to be a part of the car parade. So we had a really good time, and we expect to do this a couple more times during the summer. We've raised $550 already, so that's not small change. We're doing very well. So yeah, please join us.
It's a lot of fun.
It is a lot of fun.
Yeah,
it is a lot of fun.
Okay, and the treasurer's report. Ken, do you want to say something about it, or should I?
Let me unmute. Okay, there I am. Hi.
Hi,
okay.
Ken.
Yes, this month we've had a particularly good month on sustaining donations. We've had 28 sustaining donations in this month alone. That's a pretty good, which brought in a total of $965. So this was the month of May. I haven't done any tallying on June yet, but let me start out the report by saying that these little ways of bringing in money are taking hold. The car parade, the merchandising, the stamp donations, they're all starting to help us. I know we used to do a 50-50 drawing every month in the meetings, and since we're not having those, we have very clever people in this group, and this really shows a very distinctly when I put together this report and stuff. So that being said, let me go over some of the numbers. We started the month of May at $19,480.27. Sustaining donations was $965. And we also had new memberships of $250. This one program of giving money for stamps so that we could send out postcards, very successful, $160 in the month of May. So we've brought in $265 total for our stamp donation. Very helpful in getting these things out. And of course, our merchandising sales were, we brought in water bottles, jewelry, face masks, t-shirts, and a Obama book from last meeting. Thank you, Heather. So that was, our total donations was $1,765. We had very small expenses in May, $101. And so we ended the month at $21,143.56. And so there are some expenses for this month, very small ones though, like for example, our web hosting and so on. But we're currently at $21,400. So we are a healthy club, and it's because of members like yourselves that really keep this thing going. And I do appreciate all you've done. Thanks very much.
Thank you, Ken, for keeping track of us. You also see there that we've already made previous contributions to candidates, and the board will be bringing forward a recommendation at the next meeting to make more contributions because we're not probably going to be opening an office, and we had budgeted for that. And so that means we have more money to give to candidates. So we have to make some decisions about where to spend our money. And this is what the club is for, is to elect Democrats. So thank you very much. And please stay safe, stay healthy, stay engaged, which will help you stay healthy. And know that we are all in this together. And if you have any ideas for things that we can do in the club, please email me or get in touch with some of the people who you heard talk tonight on the Zoom. And thank you very much, and bye-bye. Bye, everybody.